Bariatric surgery is one of the best tools we have for treating obesity, but there's a long-term risk that doesn't get nearly enough attention: bone loss. As a dietitian, I'm here to tell you it's preventable if you know what to do. Hey, welcome back to Real Talk Nutrition. I'm Tradina. I'm a registered dietitian nutritionist and a developmental psychologist. Today's topic is one that I feel genuinely passionate about bringing attention to because it affects so many people in the bariatric community and is almost never talked about in the pre-surgery education that patients received. We're talking about bone health after bariatric surgery, specifically the real risk of bone density loss and what you can do about it starting now. Here's why bariatric surgery increases bone loss risk. It comes down to two main factors: nutrient absorption and hormonal changes. Most bariatric procedures, particularly gastric bypass and duodenal switch, involve some degree of malabsorption. Calcium and vitamin D, which are critical for bone density, are among the nutrients most affected. If you're not absorbing enough calcium, your body takes it from your bones. The second factor is hormonal. Weight loss itself, regardless of how it's achieved, often involves changes in hormones like estrogen and leptin that play a role in bone metabolism. For women in perimenopause or postmenopause who are already at elevated risk for bone loss, this is a compounding effect that deserves serious attention. Research shows that bone mineral density can decrease significantly in years following bariatric surgery, and this is associated with increased fracture risk, particularly in the hip and spine. What you can do about it: first, take your calcium citrate, not calcium carbonate. Citrate or citrate is better absorbed post-surgically. Most bariatric patients need 1,200 to 1,500 milligrams per day, or 1,200 to 1,500 milligrams per day, split into doses of no more than 500 to 600 milligrams at a time because that's the absorption limit per dose. Second, get your vitamin D levels checked and keep them in a healthy range. Vitamin D is critical for calcium absorption, and vitamin D deficiency is incredibly common post-bariatric surgery. Third, do weight-bearing and resistance exercise. This is one of the most evidence-based interventions for maintaining and even building bone density. Walking counts, strength training counts even more. Fourth, get a DEXA scan. If you're 2 or more years post-op and you haven't had a bone density scan, ask for one. Knowing your baseline lets you and your team intervene proactively. This is preventable, but only if you know it's coming, and now you do. Now, before you go, if you want ongoing support from a community that gets it, come join me in my free Facebook group. And if you're ready to go deeper, I have a monthly group coaching membership called the Real Talk Continuum. This is where we do the real work together: the nutrition, mindset, the whole picture. Details for both groups are in the description below. If this video was helpful even a little bit, please subscribe and hit that notification bell so that you never ever miss an episode. I post new content regularly and I don't want you to miss it. I'll see you next time. Goodbye.